don't you sit down and we can get started. So, do you mind if I take notes? It helps me as we're moving along to sort of have something to reference. Okay, cool. Thank you. So, what brought you into the clinic today? Okay, so your wyvern, Skullmuncha, was saying that. Can you repeat that for me one more time? Okay, so there's something different about you, like from before, or different from, okay, from how you were before. Can you tell me a little bit about that? What might he be talking about? Okay. So you found a crown, and that was okay in an old grave. Was that like a Nehekaran grave, or was this found somewhere in the Empire? Okay, cool. And what, can you remember what it was like before you found the crown? Okay, so you were just a boss. Okay. So, and then after you found the crown, okay. So, you were a boss, you found the crown, and now you're a war boss. Okay. And what about this crown is actually the thing that makes you think it's the reason that you're feeling different? Okay, so you put the crown on, and you started hearing voices. A voice, okay, a voice. And this is not your voice. This is somebody else's voice. And do you hear this voice? Like, is it coming in through your ears, or do you hear it from inside your head? Okay, coming in through your ears. Okay. And does it tell you to do things? Okay, sometimes. What kinds of things does it tell you? Okay, so a recent campaign was actually the idea of this voice. Okay. Is this the kind of campaign that you would have gone on before you found the crown? No, okay. Would you say you're feeling more ambitious now than you were? Okay. So, you found the crown, and you're now starting to feel more ambitious. You've gone from being a boss to a war boss, and you've gone on a, how would you describe the campaign? Would you say it was risky? Would you say it was pretty standard? Bold, okay, bold. You went on a bold campaign. And you attribute going on this campaign to this voice that you're hearing, that the crown is. It's actually the crown whispering to you, okay? So the crown is actually whispering to you. Has this had any effect on your life outside of your career, or is it just within the realm of fighting? Sorry, did you Did you feel like something changed just now? Yeah, I thought so. We've been having some problems with the winds of magic around here recently. So, sorry about that. Please, if it happens again, just try to, I guess, stay centered, because it can be a little disrupting sometimes. Okay, so, what were we talking about? Right. So, do you have a romantic partner? No, okay. How about friends? Have they... Obviously, you're here because Skullmuncha thinks that you should be seeing someone. So has anybody else noticed? Okay, so all of your underlings they're saying it's a good thing. Okay. And why do you think they're saying that? Okay, because they're orcs. Okay. Okay. So, just, because eventually, before we leave today, I am going to have to come up with a diagnosis so that your insurance can cover these sessions. So do you mind if I actually get my diagnostic manual right now? Because right now I'm thinking you may have something called Schizoaffective Disorder. And actually, let me explain basically what that is before we actually get the manual out. So, basically, have you heard of schizophrenia before? Okay, so you know what that is. Schizophrenia is primarily characterized by delusions and hallucinations. So, this voice that you're hearing, the voice of the crown, yeah, that is what we would call a hallucination. It's an auditory hallucination, because there's no one actually around speaking to you. And the reason why, first of all, I don't believe that you qualify for schizophrenia. But the reason why I think it may be schizoaffective is because you're exhibiting some signs of being in a manic episode, or at least you had a manic episode previously, and now you're here. Do you still feel this heightened sense of ambition? This, do you feel driven? Do you feel like you don't need to sleep? Okay. So not anymore. Okay. So then it sounds like you had a manic episode. But now you've returned to baseline. So I'm just gonna grab it's called a DSM-5. I'm gonna grab that. It's right next to me. And I want to ask you a few more questions just to really nail this down, okay? Okay. So, let me find the section here. Sorry, this can take a second. Goodness me, where are they? Schizophrenia. There we go. And I just want to remind you, I do not believe that you have schizophrenia. I believe you have something related. Schizoaffective disorder. Okay. So, the voices and your sense of drive, your sort of your rise to power, would that be a fair way to put it? Those coincided with each other. So right now you're not wearing the crown right now. Do you hear anything? You do. Okay. I just want to be clear, it's not on you anywhere. Okay, you've left it back at the war camp. Okay. So the crown is not anywhere near you right now. So are you still hearing the voice of the crown then? Okay, and is that because it stayed with you? Okay, so because you wore the crown for so long, now the spirit is within you or somehow attached to you. Okay. Over what period of time? When did you find the crown? How long ago was that? Okay, so that would be, how many months would that be? That would be 6. Okay. So you found the crown 6 months ago, and that was around the time. That was the time when the voice started talking to you. Okay. And I'm sorry, can you remind me how long after finding the crown did you start feeling this this drive, this feeling of power, this what we've been talking about, the feeling that the voice gave you? Okay, so it took a couple weeks, like 2 weeks, 3 weeks, 3 weeks. Okay. 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 And you're not using any drugs. You're not drinking heavily. Are you getting enough sleep? I mean, when? Okay. Okay. Yeah. Okay, so I'm feeling fairly confident at this point that I can write on your paperwork that you have schizoaffective disorder. And I want to be clear, this is not a box that I'm trying to fit you into. This does not define you, because obviously you are Azhag, you are the Slaughterer. You are not just someone with a schizophrenic-like disorder. And this is strictly for insurance purposes. So, if you choose to stay in therapy, which I strongly encourage that you do, then the work that we do will be for you, not for what I have to write down. Because if I don't do this, then you have to pay out of pocket, and that's no good, because I want you to continue to come to these sessions. All that to say, I don't want you to worry too much about this. However, I do feel that in your case it's important that you know, particularly right now, because this is probably going to be something that's going to involve some medication just to control the hallucinations. Because, okay, you're right. The hallucinations are actually being very helpful for you. So, in your case, we may not actually need to medicate, but this is probably going to be something that I may need to refer you to a specialist for. Just, down the line. So I think it's important that you know why that might be happening. And especially because, insurance companies might let it slip anyways, and I'd rather you hear it from me than from them. A client who discovers that they've been diagnosed with something that they haven't been told by their therapist about, that's not great for a relationship that we need to build in order for you to see any sort of positive growth. Okay, yeah. So, for now, what I'm gonna do is I'm gonna fill this paperwork out that I have to in order for me to get reimbursed from your insurance company, so you don't have to pay. And I'm also gonna ask you to try to keep track of the kinds of things that the voice is saying to you. Because you had mentioned that it tells you to do things sometimes. Okay. At no point has it ever told you to hurt yourself. Okay. Okay, it's strictly a conquering voice. Okay. Well, that's thankfully not going to be a problem, given who you are and where we are. So I want you to sort of, if you can, keep a record of the kinds of things that the voice is saying to you. I also want you to spend some time thinking about if it has had an effect in other places in your life. Yeah, okay. So why don't we schedule an actual full session? What time works? What days work for you? Okay, and that's, my conversion's a little off. That would be a Thursday, okay. So, Thursday. And are there any times in particular that work well for you? Just after midday, okay. So we'll call that Thursday, 2 p.m. And if you need anything, I'm going to give you I would give you my phone number, but I suppose that's not particularly helpful for you. I will give you a couple messenger pigeons, and they will be able to bring me any urgent messages that you may have for me. That could be pretty much anything, within reason, of course. If it's you have an urgent need to talk to me about something, if you have a question that can't wait until the next time we see each other, that would be the kind of thing that you would want to use one of these messenger visions for. Yeah, so before you go, I just want to ask, do you plan on coming next week? You do? Okay, that's great, because it's really important that we keep doing this, because it seems like you want to make progress on this. Otherwise, I would imagine you wouldn't be here. And as long as you're willing to come here and work with me, then I am willing to work with you. So, great. That's excellent. Thank you. Okay, I will see you next week, Thursday at 2 p.m. All right. Have a good day.